As you probably know, the cardiovascular system is made up of several components consisting of your heart and its 4 chambers, as well as arteries, veins, and capillaries, which transport your blood around your body. Arteries transport your blood away from the heart, while veins transport blood back to the heart. Capillaries are the small middlemen between the two and serve to provide nutrients and oxygen and carry away waste products from cells. The heart is the sole pump for the entire circulatory system and circulates blood around your body between organs. Because of this, the heart is an imperative part of your body, and when it isn't working properly, it can cause various serious issues, including death. One of the many ways your heart can become compromised is when a blockage forms in one of your arteries or veins, which reduces blood flow and damages and kills cells if proper blood flow is not restored in time.
One example of this is coronary artery disease, also known as CAD. CAD occurs when there is a narrowing or blockage in the coronary arteries, creating a partial or complete blockage of blood flow to the heart. The most common cause of CAD is atherosclerosis, a condition where cholesterol and fatty deposit build up in the arteries and become plaques. As the plaque grows, the vessel diameter progressively decreases, increasingly limiting blood flow to the heart. Reduced flow causes the arteries to not be able to meet the heart's demands for oxygen and nutrients. Chest pain, also known as angina, is a common symptom of partial blockages. However, in most severe cases, typically complete blockages deprive the myocardial cells of any oxygen or nutrients, leading to cell death and a myocardial infarction. There are several genetic risk factors for CAD, which including being older-aged, male, African American, or having a family history of CAD or another heart condition. Since plaques develop over time, most people do not know they have any problem until they are of an older age. Because of these, most individuals who are diagnosed are older adults, and therefore having a healthy lifestyle is encouraged to delay growth of plaques. Lifestyle risk factors for CAD include smoking, obesity, low physical activity, high cholesterol, high blood pressure, and chronic stress.
Since coronary artery disease is a progressive disease, many individuals do not experience symptoms until the condition has become a serious concern. Men and women also often display different symptoms. One of the most common symptoms of coronary artery disease is angina, as previously mentioned, which is pain in the chest as a result of an oxygen deficiency in the heart. There are several other symptoms, including heart palpitations, a fast heart rate, also known as tachycardia, dizziness, nausea, and shortness of breath. There are several clinical methods used to diagnose coronary artery disease. One common one is done using an electrocardiogram, also known as an ECG. ECG tracings are used to look for any abnormalities in the electrical conduction pathway in the heart. Several abnormalities on an EKG are indicative of coronary artery disease. An arrhythmia is one that is commonly seen. Arrhythmias are a sign of nodal failure due to lack of nutrients, which creates an irregular heartbeat, most commonly of the sinoatrial node. ECGs also reveal evidence of previous heart attacks, which is commonly seen in ST segment elevations. Another common method is exercise stress testing, which utilizes ECG data along with taking data for blood pressure to test the heart function under stress. Another clinical test used to diagnose CAD is coronary calcium scans, which are a type of CT scan investigating the artery walls for calcium buildup indicative of a plaque. Blood tests are another clinical diagnosis method that can provide evidence of an individual may have CAD if they have elevated triglycerides and cholesterol.
So now you must be thinking, what forms of treatment are available to help individuals who have been affected by coronary artery disease? If surgery is needed, there are 2 options that could be used to help the CAD. One of these procedures is the coronary artery bypass surgery, which involves using another vessel so blood can get to the heart without trying to flow through the region where the blockage is. It helps restore blood flow to your heart muscle through diverting the flow of blood around a section of blocked artery in the heart. The other surgical procedure that helps with CAD is called the balloon angioplasty. This procedure helps to expand the diameter and place a stent to keep the vessel open. The balloon angioplasty focuses primarily on opening up narrowed and blocked arteries. To help continue with the patient's health, there are two medications that could possibly be prescribed called beta blockers and aspirin. Aspirin helps out a lot as blood thinners due to the chance that blood clots can occur and will help slow down the formation of these clots. Beta blockers are sometimes also prescribed to patients dealing with CAD in order to lower the heart rate blood pressure, which in turn helps relieve angina, chest pain due to reduced blood flow from appearing in the patient. An individual's first concern with treating CAD starts with making certain life changes in their health. A patient should refrain from smoking in order to prevent toxic particles from furthering the damage in their system. They should also try their best to implement a better workout regimen in their life in order to help the heart pump more blood through the body and continue to work at optimal efficiency without any strain. Lastly, a patient should also make a change in their diet, focusing on more healthy food groups which would have less of a chance of having plaque build up in the arteries.